So the first thing I'm going to do is perform hand hygiene. I'm going to knock on the door, provide some privacy. Hi, my name is Maddie. I'm going to be your student nurse today. Can I get your name and date of birth?
Michaela Wenger, 11/16/2001.
Great. Can I check your wristband? Thank you. So can I have verbal consent for this exam for educational purposes?
Yes.
So before we get started, do you have any pain in your joints?
No.
Okay. So the first thing I'm going to do is inspect the neck. I'm looking midline, and I'm going to see that the skin color matches the ethnicity. There are no lesions, no cervical or muscular deformities. Next, I'm going to palpate the neck for tenderness or masses. So I feel no tenderness or masses upon palpation. So now I'm going to test your range of motion and strength of the neck. So if you could just shrug your shoulders, and now you're going to shrug against resistance. Great. And then I'm going to have you put your left ear to your left shoulder against resistance, or the other way, yeah.
This one?
Yeah. Like this.
Oh.
Yeah. And then the other side. Okay. And then I'm going to have you look up and down, and then look left and right like this. And now against my resistance. Okay. So there's full range of motion, and you get +5 for the strength of your neck. All right. So now I'm going to inspect the upper extremity joints. So I'm looking at the shoulders, the elbows, the wrists, the hands, and fingers. I'm looking for symmetry, so the upper extremities are symmetric. There are no deformities, no muscle atrophy, and there is no erythema. And then I'm going to palpate, feeling for temperature, texture, moisture. So in a clinical setting, she would be wearing like a Johnny, so I could feel it on her skin. But I'm going to be doing with the back dorsal aspect. From the shoulders to the fingertips, the skin is warm, dry, and intact. Next, I'm just going to palpate your joints. So I'm going to feel your shoulders, your elbows, wrists, hands, and fingers. So I feel no crepitus or masses. Do you feel any pain when I do that?
No.
Okay. So now I'm going to test the range of motion for the joints, the shoulders, elbows, wrists, hands, and fingers. So can you just put your hands up like this, like you're going to punch someone? Okay, so I'm going to put my hands right here, and you're going to pull in. And I'm going to push out, okay? And now I'm going to have your hands lower, and I'm going to do it again, okay? And then your elbows out like a chicken wing, and push up and down. Awesome. And then I am going to have you put your arms out like this, and push up, down, and then go like that with your hands, and then same thing, up and down. Okay, so there is full range of motion in all the joints of the upper extremities, so you get 5 out of 5 for the strengths. Now on to the lower extremities. So I'm just going to be inspecting the hips, legs, knees, ankles, and feet. I'm looking for symmetry. So the lower extremity joints are symmetric. There are no deformities, no muscle atrophy, or no erythema. So I'm going to have you lift your knee, so just like go into my hand, and the other side, and then push down. Okay. And then I'm going to have you kick out your foot into my hand, and then pull it back in. Okay. And then I'm going to have you put your legs out like this. And then can you press down like you're pressing on gas? And then press up. Like with your ankles, yeah. Yeah, awesome. Thank you. And then can you just rotate your ankles like that? Yeah, and then the other one. Okay, so there's full range of motion in all the joints in the lower extremities, and that's a 5 out of 5 for strength. And I'm just going to palpate the joints. So feeling from the hips down, directly on the skin, feeling for temperature, texture, moisture. The skin is warm, dry, and intact. And then I'm just gonna feel your joints. So deferring the hips, I'm feeling the knees, the ankles, and the feet. So I feel no masses or crepitus. Did you feel any pain when I did that?
No.
No, okay. So no pain, crepitus, or masses. Next, we're gonna be moving on to the spine. So if you could just stand up for me. Okay. So if you could just turn aside, I'm just gonna be looking at the spine. Again, she wouldn't have like clothes on so I could see the skin. So I'm just looking at the cervical, thoracic vertebrae. The skin matches the ethnicity. There are no lesions, no cervical, thoracic, or muscular deformities. So now I'm going to palpate the spine. So palpating the cervical, thoracic, and the muscles of the spine. So I feel no tenderness or masses. Do you feel any pain?
No.
All right. So now I'm going to test for range of motion of the spine. So you could just turn back around. So actually, while we're standing up, I would assess for the flexion, extension of the hips. So when she's sitting, it's flexed, and then when she stands, it's extended. So I would be assessing for that. And while we're also standing up, because you don't want to have the patient be standing up and down if they have orthostatic hypertension. So you would take the leg and do adduction, abduction while they're standing. So could you just go like that? And then the other side. Okay, and then, so back to the spine. Could you bend forward for me, please, just like that? And then backwards. And then side to side. And then could you rotate like this? Great, so there's full range of motion of the spine. That's it, thank you.